Welcome to Beyond the Wheeze, the podcast where real stories meet expert insight on asthma and other chronic respiratory conditions. I'm your host, Josh Rayon, asthma advocate and patient voice. Each week, we explore the challenges, progress, and possibilities shaping respiratory care. Through conversations with patients, clinicians, and changemakers, we shine a light on what it means to live and breathe better. This is Beyond the Wheeze. Today, I'm honored to welcome Jenna Reynolds to the show. Jenna is the Vice President of Mission, Advocacy, and Research at Asthma Canada. In this episode, we're talking about the future of asthma care in Canada and what it will take to close the gaps in access, education, and support that are still affecting patients and caregivers every single day. And by the end of this conversation, you're going to walk away with a clear picture of what asthma care should look like in Canada, why so many families still struggle to get proper support, and practical steps you can take right now as a patient and caregiver. With all that being said, Jenna, welcome to Beyond the Wheeze. It's so great to finally have you on.
Oh, thank you. I'm excited to be here.
We have had your CEO, Jeff Beach, on prior. I believe he was episode 4, somewhere near the start of season 1. Now we are in season 2, which is a little bit different, but more or less the exact same thing. So happy to have another representative of Asthma Canada on. So we'll hop right into it. I first want to discuss the human why. Jenna, what pulled you into this work in the first place, and what's kept you committed to asthma advocacy all these years?
Right. So asthma has been a part of my daily life in my family. So this work has always been personal to me. I learned early on that good control depends on access to information, but also the right care. Asthma is incredibly common in Canada, but it's still often not taken seriously, both by the system and sometimes even by the people living with it or their families and caregivers. At Asthma Canada, we hear often, it's just my asthma all the time. And too often, that ends up in crises that could have been prevented. I've been at Asthma Canada since 2014. So what's kept me going and what's kept me here is knowing that asthma is manageable when people have the right education, the right support, and the right access to care. And I've seen that real change is possible. So that's what keeps me committed because better asthma care isn't just theoretical. It's something that we can actually achieve.
When you think about the people you serve through Asthma Canada, what's the story you've heard the most? Maybe the pattern that keeps repeating itself across Canada?
The story we hear repeatedly is one of people not taking asthma seriously. Sometimes, again, it's even the person living with it, and sometimes those around them, and sometimes it's the healthcare system as a whole. People often underestimate how dangerous asthma can be. It means they delay seeking care. They rely only on the rescue inhalers. So this lack of awareness and urgency can really put them at real risk. Hearing these stories keeps reminding us why education, advocacy, and support are so critical. Because when asthma is taken seriously, outcomes improve and lives are saved.
Couldn't agree more. And let's move into the reality check. What's broken right now? If you had to describe asthma care in Canada today in one sentence, what would you say?
Asthma care in Canada works well for some. But for far too many people living with asthma, it's inconsistent, unequal, and leaves people at risk.
Where do you see the biggest gaps right now?
So there are a lot of gaps, but the biggest ones we see show up around access generally. So that's access to diagnosis and testing, access to ongoing care, education, and then access to medications. So when we're looking at access to diagnosis and testing, too many people are never diagnosed using objective testing like spirometry. A lot of people are assessed at a walk-in clinic or a primary care visit. They might be told they likely have asthma, given a rescue inhaler, and that's kind of where I might stop. So if you compare that to something like diabetes, people get tested, they get their numbers, they know what's going on. But with asthma, we often skip that step. And that sets people up for poor control from the start. And then that moves into things like access to ongoing care and management. So asthma care pathways are complicated and inconsistent. And so a lot of people fall through those cracks really easily. A lot of patients get on an inhaler once, and then they don't have that structured follow-up or regular check-ins. So we really need more allied health, certified respiratory educators really embedded in primary care to support ongoing management, not just crisis care at the ER at the hospital. And then education. Education is still treated as optional when it's actually foundational to asthma management. That means asthma management really comes down to two things. It's both about minimizing triggers and your environment, but also using the right medications properly. Without education, people are not recognizing worsening symptoms early. They don't understand their triggers, and they don't know when to seek out help. And then lastly, a big component, of course, is access to medications and treatment. So cost and coverage are still major barriers in Canada, especially for controller medications. So when people can't afford or access the right medications, they rely on rescue inhalers and emergency care instead. So that leads to worse outcomes for patients and higher costs for the healthcare system overall.
If a parent or patient is listening right now and thinking, this sounds like me, and it did previously sound like me, what are the top signs they might be stuck in a system gap?
Yeah. So some big flags are frequent emergency visits, relying mostly on or only on a rescue inhaler, or feeling unsure about triggers or how medications are supposed to work. Another sign really is feeling dismissed or unheard when you raise concerns through a healthcare provider or with a healthcare provider. So if any of that sounds familiar, it's just a sign you might be falling through the cracks of the system. Not that you're doing anything wrong. The first step really is to ask for a reassessment of your asthma with a healthcare professional to really look at control, your medications, and whether the plan that you have still makes sense for you. It's also worth getting informed and prepared before that visit. Resources like at asthma.ca can help people understand what good asthma care should look like and the questions to ask. Really, no one should feel like they're managing asthma alone, and there are supports out there to help people get back on track.
Those are great tips, and I will be sure as well to leave Asthma Canada's resources in the show notes for the listeners. I'd like to move on now to access, diagnosis, follow-up, and geography, which we know can be an issue. Let's first talk about diagnosis. What does a proper asthma diagnosis look like, and what's going wrong when people don't receive proper testing?
Proper asthma diagnosis should include objective testing, like spirometry, not just a symptom conversation. Too often, people are told that they probably have asthma, and they're given a rescue inhaler without really confirming what's actually going on. With something, again, like diabetes, you get blood work, you get numbers, you know where you stand. With asthma, we often skip that step entirely. Again, that's just the health system's issue with our constrained healthcare system that we have. Too many people are diagnosed based on a shorter clinical assessment, especially in walk-ins or episodic care, and that's where it ends. So without proper testing, you don't actually know if it's asthma, how severe it is, how risky it might be. That leads to undertreatment, over-reliance on rescue inhalers, and people thinking that their asthma is mild when it's actually not well controlled. So when diagnosis is weak at the start, everything that follows, treatment, education, follow-up, that is built on that shaky ground.
And what should patients know about follow-up care? Because as you mentioned earlier, a lot of people get an inhaler and then usually a rescue inhaler, and then basically they're on their own.
So getting an inhaler isn't the end of care. It's really just the beginning. So asthma isn't static. It's chronic. Symptoms change, triggers change, seasons change, life changes. So care needs to change along with that. Follow-up shouldn't just be about whether someone has medication. It should be about whether asthma is really and actually controlled. Asthma.ca has a number of resources and simple tools to check if your asthma is well controlled and if you should request a check-in or a reassessment with your doctor. Inhaler technique matters a lot. And honestly, it's often not really checked after that first prescription. People should expect regular check-ins that look at symptoms, triggers, how medications are being used, and whether their asthma action plan still makes sense. So this is where education and management really come in. Asthma control is about minimizing triggers, and it's also using the right medications the right way, and that includes your controller medications. And certified respiratory educators, other allied health professionals are so important here as well to support family physicians, general practitioners, and specialists, because they have the time and the expertise to support a lot of that ongoing management and education. So without that follow-up, people often come back into the system only when something goes wrong, usually again through the emergency department. And if you go to the ER, you definitely should be following up with your primary healthcare provider for that reassessment and a reevaluation because you are not in control.
Now, when I was young, up until I was an early adult, I was affected a lot by the access gaps here in Canada. I came from a rural community. I came from a low-income family. We didn't always have a consistent family doctor. So my question for you is, who is affected most by access gaps in Canada, and what needs to change?
So with over 4.8 million people in Canada living with asthma, not everyone has the same opportunity to manage their condition and live symptom-free lives. Recent data shows that children and youth in the lowest income neighborhoods are hospitalized with asthma 1.5 times more often than those from higher income areas. Hospitalization rates are also twice as high among households with lower levels of education, indicating that social determinants of health strongly are influencing outcomes. Meanwhile, Indigenous communities, First Nations, Métis, and Inuit experience asthma rates at nearly 40% higher than the general population. And that's compounded by barriers to accessing regular healthcare providers, safe housing, affordable medications, lack of trust within the healthcare system. And as you mentioned, there is vast unequal access to care across the country, depending on the region you're in, the jurisdiction, rural to remote. People in lower income, underserved areas, rural, remote areas are facing longer wait times for specialist care, greater travel distances for services, and more frequently emergency visits due to those challenges in managing asthma effectively. So really what needs to change on this is better integration of care closer to where people live, the stronger use of allied health, community health care, and systems that don't rely on people navigating everything on their own.
Couldn't agree more. And with that, we'll hop into education, the missing piece that changes outcomes, and the reason why I got into advocacy in the first place. And we'll start with a simple make-believe question. If you could wave a magic wand and make all Canadians understand 3 things about asthma, what would they be?
So asthma is a serious, potentially life-threatening disease. Asthma is not just annoying or something that you can ignore when you're not feeling symptoms. Even if symptoms seem mild or intermittent, asthma attacks can happen suddenly and they can be life-threatening. Over 300 people in Canada per year die from asthma. So taking asthma seriously from day one is critical to staying safe and being healthy. With properly controlled asthma, people can live full and healthy lives. Asthma just should not be limiting what you can do. So with the right care, right education and management plan, people with asthma can go to school or work, play sports, exercise, travel, and enjoy life just like anyone else. Control is possible, and that can transform daily life. And then relying on a rescue inhaler most of the time is a sign of uncontrolled asthma. So this is a really important one that all Canadians should know. A rescue inhaler is meant for emergencies, not just daily use. So if someone is needed frequently, it's a warning sign that their asthma isn't properly controlled. This is a signal, a warning to check your treatment plan, review triggers, and speak with a healthcare provider to prevent serious attacks.
Yeah, and maybe an important note as well, if you are on a controller medication, and Dr. Alan Kaplan brought this up on his episode with me, I believe that was season 1, episode 14, but it was that naturally as humans, when we get better, we kind of segue away from taking that medication that we think probably isn't helping because we don't need it. At the time, you think you don't need it because that medication is working. So don't just stop taking that medication. Very important.
Absolutely. That is the thing, is that asthma is a chronic condition. It's not symptomatic. You might feel it that way because when you're feeling those symptoms, that's when you're focusing on it. But it is chronic, so it needs to be treated consistently with controller medication. So Dr. Kaplan has some wonderful educational resources and support for that.
You mentioned the right asthma education. What does that actually include?
So good asthma education teaches people living with asthma and their caregivers, families, to recognize symptoms, use inhalers correctly. So that includes, again, controllers, not just a rescue inhaler, understand triggers, and follow a personalized asthma action plan. But also helps them to know when to seek help and how to prevent attacks before they happen. Education empowers people to act early and avoid emergencies and take control of their asthma so they can safely, confidently, and live fully with their asthma.
And if you don't think you're taking your asthma medication properly, or you think maybe, oh, I've gone way too far at this point to learn how to do it, you're not alone. I didn't learn how to take my asthma medication, my inhalers correctly until I was in college, and I learned off of YouTube. It is a thing. It is something that needs to be taught, and there is a proper way to do it. And that is one good reason why education is key.
And you definitely are not alone in that. 80% roughly of people might not be using the rescue inhalers or their inhalers properly. So that is consistent with that, but that's why the education can always be learned. A lot of people too, when you think about it, you might have gotten your inhaler as a kid or as a teenager or as a young adult. And so you might not have thought about re-upping your training in a long time. So you can ask your pharmacist. You can go on YouTube or watch some inhaler videos on how to do this. You can call Asthma Canada's helpline to speak with a certified respiratory educator, talk to your healthcare professional to actually test how you use your inhalers. So you should bring all your inhalers and your medications to any appointments you have and actually show how you do it, to have that information, that education with someone that can ensure you're doing it properly.
My next question, Jenna, what should schools be doing better to support kids with asthma? And what are the biggest gaps in school readiness right now?
Absolutely. So schools play a critical role in keeping children with asthma safe and supported. Asthma is a very common chronic condition across all ages, but roughly around 12% of kids are living with asthma. So in every classroom, there's likely a kid or two living with asthma. And so there are still major gaps in readiness. Many schools lack clear policies that allow students to carry and use their own inhalers. Staff are often not trained to recognize or respond to asthma attacks. And there's limited awareness of triggers like allergies, allergens, exercise, seasonal changes. So those gaps mean that even well-managed asthma can become an emergency at school. Asthma Canada has been actively working to address those gaps through advocacy. One tragic example is that shaped our work was the death of 12-year-old Ryan Gibbons in Ontario. He suffered a fatal asthma attack at school because his inhaler was in his principal's office. And his story led to Ryan's Law, which was legislation in Ontario that ensures students with asthma can carry their inhalers and that schools have proper asthma management policies. Asthma Canada supported that legislation, showing how advocacy can turn tragedy into meaningful change and make schools safer for children with asthma across the province and also through other jurisdictions that we're doing that work with and continuing. Ultimately, schools need consistent asthma policies, staff training, and emergency preparedness so that all children with asthma can participate fully in school life without unnecessary risk.
Terrific. I'd like to move on now to medication access and cost. When it comes to asthma control, how much do medication costs and insurance access shape asthma outcomes in Canada?
Cost and insurance coverage play a huge role in asthma outcomes, not just for the person living with asthma, but for the healthcare system as a whole. The gaps in coverage are what makes people with asthma really suffer. So many people do have insurance through their employer, a family plan, but precarious employment, being young and aged out of their parents' plans, or being in between public coverage, turning 65, can leave people without adequate support. And on top of that, copays, maximum deductibles add another barrier. Asthma medications might not be as expensive as some treatments for other conditions, like cancer, but they represent a significant financial strain. People often have to make difficult choices between paying for their inhalers or covering other essential bills. So when medications aren't affordable, asthma control suffers. That leads to more attacks, more emergency visits, more hospitalizations, and a larger overall strain on the healthcare system, on the family and caregiver impact, and of course, the quality of life of the person impacted. So ensuring people have access to the medications that they need isn't just a matter of fairness and safety, that's smart healthcare policy. So proper access reduces preventable attacks, protects daily life, and lowers overall cost to the system.
I know around wildfire season, I typically have a spike in exacerbations for myself. I mean, I think a lot of asthmatics out there do. And I remember this past wildfire season, I needed an extra inhaler. I had gone through my rescue inhalers and I called my pharmacy. And what they told me was, well, you've had two within the last X amount of days. I want to say 90 days. So for your next one, you have to pay for it. It won't be covered. And that's an issue. Now I know, $23 for a Ventolin inhaler isn't going to break the bank. But it could for some people. I mean, I'm doing okay myself, but I wasn't when I was a kid. That would have been an issue. $20 as a kid for me and my family would have been the difference between eating supper that evening or not.
Absolutely. I mean, it might seem like a small amount, but it can be massive for many people and many families. Particularly, again, we're looking at wanting to have proper control, right? Which should be your controller medications and always having your rescue inhaler, as you said, for those emergencies. And so if you had to make the consideration of if you can afford it or not, that is adding an undue burden on an individual and their families.
What do decision makers underestimate about what happens when people can't afford controllers?
Decision makers often don't fully realize the full ripple effects of people not being able to afford their asthma medications. It's not just missed doses. It affects daily life, school, work attendance, sleep, mental health, family stress. So people may rely more on emergency care, which is far more costly and disruptive than proper preventative treatment. Beyond the individual, it impacts communities and the healthcare system because preventable attacks put additional strain on hospitals and healthcare resources. Really simply put, the consequences of unaffordable medications go far beyond the person living with asthma. They affect families, schools, workplaces, and the healthcare system as a whole.
Looking ahead, what needs to happen to make newer therapies, including biologics, accessible based on need rather than privilege?
We need clearer, more consistent care pathways so people who need these therapies are identified earlier, not years into uncontrolled severe asthma. Our system is quite inequitable across provinces and jurisdictions. And so those gaps are, again, even wider in rural and remote communities. Coverage decisions should be grounded in evidence and real world outcomes, not just short term costs, especially when severe asthma leads to repeated ER visits and hospitalizations. One tangible way that happens is through national advocacy, like how Asthma Canada engages with Canada's drug agency, CDA, to get asthma medications listed on public formularies, which then improves access across public and private plans. And that choice matters because people don't all respond the same way to an individual treatment. Access needs to be based on patient need and health outcomes, not forcing people to, fail multiple therapies before they finally get to the one that works.
I'd like to move on to the future, or rather what asthma care should look like. If you could build the ideal asthma care pathway in Canada from scratch, what would it look like?
Absolutely. So it's important to look at it, holistically from the beginning through management and the entire life cycle. So from first symptoms to diagnosis, people will be taken seriously early on and get proper testing, like spirometry, instead of being told they probably have asthma. Diagnosis would be timely, consistent, not dependent on where you live or whether you have access to a family doctor. So from the start, there'd be clarity about severity and risk. So care is matched to what the person actually needs. And then education and action planning, a critical component in managing asthma. Education will be built into care from day one, not treated as an add-on or a nice to have. Every person would be equipped with an asthma action plan that they understand and actually use. Education would cover triggers, management, symptom recognition, when to seek help so people can manage asthma confidently day by day. Then medication access. So people would have access to the medications and treatments they need based on clinical need, not insurance status or postal code. And there would be real choice in therapies, recognizing that one size does not fit all. And cost should not be a barrier to staying well and preventing asthma attacks. And then follow-up. A crucial component in managing asthma is that continued care, as it's a chronic condition. So follow-up would be routine, expected, not something that only happens after a crisis. Care should be team-based, with certified respiratory educators and allied healthcare professionals supporting that ongoing management as needed alongside family physicians, general practitioners, and specialists. So the goal really is long-term control and improving quality of life, keeping people out of the ER. And that lets people live fully.
Now, in the short term, what are the most realistic changes do you think we'll see in the next 5, maybe 10 years?
So we have to be honest that we are in a healthcare crisis across Canada, not just in asthma care. Underinvestment, an aging population, a workforce that's stretched, retiring, practice scope changes, and a lot on their shoulders. Expectations keep increasing, but the system doesn't have the capacity to just keep adding more without changing how care is delivered. So for asthma and respiratory care, the most realistic progress is going to come from that better education, that self-management, so people aren't relying on crisis care as their main option. So we really need to see, again, more focus on that clear care pathway, helping patients move more efficiently from diagnosis to the right treatment, embedded with education throughout that process. And a big part of this, that I think there's big potential in, is the better use of certified respiratory educators and allied health professionals embedded in primary care and community care settings. That kind of team-based care can help support patients earlier, take some pressure off GPs and specialists, but also, again, keeps it in the community, in family health teams, rather than in hospitals and in ERs.
I'd like to move on to a new segment that I've added to season 2. It's called Myth versus Reality. I'm going to say a myth, and I want you to respond with the reality. So we'll start with myth number 1. Asthma is only serious if you're wheezing.
But the reality, asthma can be life-threatening even without wheezing. Silent symptoms like shortness of breath, chest tightening, over-reliance on your rescue inhaler, or nighttime coughing can indicate serious danger.
Myth number 2. If you have a rescue inhaler, you're fine.
Reality, relying on a rescue inhaler is not control, and in fact, it would suggest that your asthma is not well controlled. Long-term management and proper and consistent use of controller medications are essential to preventing attacks and exacerbations.
Myth number 3. If your child can still play sports, their asthma must be under control.
Reality. Children may push themselves to participate and hide symptoms. Their asthma might not actually be under control. So if your child has asthma and plays sports, keep a close eye on them and check in regularly about their asthma management. But we want all children to be able to be fully participant in sports, in school, and in life, and it is certainly possible.
And myth number 4. Asthma is annoying, but it's not dangerous.
Reality, asthma can be fatal. Asthma deaths are highly preventable, though. So taking asthma seriously and following a proper asthma management plan saves lives.
So let's talk about the asthma action plan a little bit. For a patient listening, what are 3 practical things they can do this week to improve control or reduce risk?
So have her update your asthma action plan. An asthma action plan is like a roadmap for your lungs. It tells you exactly what you should be doing on a day-to-day basis and during an asthma flare-up. So make sure you have one, review it, update it with your healthcare provider if anything has changed. Knowing exactly what steps to take care can prevent attacks from becoming emergencies. You can download an asthma action plan from asthma.ca for both kids and adults in both English and French. Review your asthma annually. So your asthma annual review is a yearly checkup to assess how well your asthma is controlled. During this visit, your healthcare provider can and should review your symptoms, triggers, inhaler technique, and your medications, and make any needed adjustments. Taking the time to review your asthma every year can help catch issues before they become serious and keep your asthma well controlled all year. Ensure you bring that asthma action plan along and discuss any asthma symptoms you are facing. And think about the whole year, because some people's asthma might be intermittent, and seasons like allergies, wildfires, cold weather can really have an impact. And then use Asthma Canada's free helpline. So Asthma Canada offers a free helpline staffed by certified asthma educators. If you have questions about your medications, triggers, action plan, anything else related to asthma or respiratory allergies, don't hesitate to call. Our CREs can provide personalized advice and support, and sometimes just that short conversation can help prevent a serious attack. We often hear from people who use our hotline that's a game changer and really can help control their condition and become more informed about managing their asthma.
For a caregiver listening, what are 3 things they can do this week to protect and support their child?
Sure, your child's asthma action plan is up to date and shared. So make sure that your child's asthma action plan is current, that everyone who cares for them, teachers, school staff, coaches, babysitters, grandparents, has a copy. So this just ensures that everyone knows how to respond quickly if symptoms arrive, which can be life-saving. Again, you can download a kid's asthma action plan from asthma.ca. And teach your child to recognize symptoms early. Help your child understand what the early warning signs are. Coughing, chest tightness, shortness of breath, and what they can do when they notice them. Teaching self-awareness gives children the confidence to act quickly and can prevent attacks from escalating. Asthma Canada has an educational game for kids called Mission Breathe, which can help teach your kids about asthma. And advocate for proper medication access and healthcare. So stay on top of your child's prescriptions, check that inhaler technique, make sure your child has regular follow-ups with their healthcare provider. If access to medications is limited or care is inconsistent, speak up, whether at school or with healthcare providers. That self-advocacy helps ensure your child gets the treatment and support that they need to stay healthy.
Finally, if someone feels dismissed or brushed off by the system, what's your advice for advocating without burning out?
Self-advocacy is one of the most important skills for anyone living with asthma or a chronic condition. It's about understanding your condition, knowing your needs, and confidently speaking up for yourself in every situation, whether that's with a healthcare provider, at school, or in the workplace. When you can clearly explain your symptoms, your triggers, your action plan, people are more likely to listen, take your concerns seriously, and provide the support you need. Granted, advocating for yourself can feel overwhelming, especially if you've been dismissed before or if you're navigating complex healthcare or insurance systems. So that's why it's important to be organized, keep a record of your symptoms, medications, and questions. Don't be afraid to ask for clarification or a second opinion. Remember, self advocacy isn't necessarily about being confrontational, it's about ensuring that your health and your safety are prioritized. And you don't have to do it alone. So, Asthma Canada offers a range of resources and tools to help you advocate effectively, from guidance or speaking with healthcare providers to asthma action plans, school accommodations, workforce accommodations. Using those tools can help give confidence, reduce stress, and make sure that your voice is heard, so that you can help manage your asthma safely without burning out.
Let's talk a little bit about Asthma Canada's initiatives now. I know that a big part of Asthma Canada's work focuses on the environment. Can you tell us a little bit about what that work looks like and why it's so important?
Absolutely. So the environment has a huge impact on asthma. With climate change, these impacts are becoming more serious. Rising temperatures, hotter summers, colder winters, more severe weather events all make asthma harder to manage. Heat waves, poor air quality from wildfires, and extreme cold can trigger attacks and worsen symptoms. And things like coal and air pollution in our outdoor and air environment. So at Asthma Canada, we focus on helping people understand the environmental risks and teaching strategies to protect themselves. And we also advocate for policies that reduce exposure to these triggers, because addressing the environment isn't just about comfort, it's about preventing attacks, improving quality of life, and ensuring people with asthma can breathe safer every day.
And with wildfires becoming more frequent and air quality being affected across Canada, people with asthma are particularly at risk. How is Asthma Canada helping people with asthma prepare for and respond to these events?
Wildfires are definitely a growing risk across Canada, and that smoke can travel long distances, creating dangerous air quality for people living with asthma. Combined with hotter summers, longer fire seasons, it's an increasing serious issue. Asthma Canada helps by providing practical support. We offer wildfire support packs, run webinars on staying safe during wildfire seasons, maintaining a dedicated information hub on our website. We also give a guidance on monitoring air quality, limiting outdoor exposure, improving indoor air, using masks if necessary, and knowing when to seek medical attention. Our goal is just to make sure that people are prepared and supported before poor air quality becomes an emergency.
And how is Asthma Canada advocating for cleaner air and stronger environmental policies to protect people with asthma?
Asthma Canada works with environmental coalitions such as the Green Ribbon Panel to push for stronger air quality standards, emission reductions, and climate policies that protect health. By advocating for systemic change, we can reduce the environmental triggers and help create healthier communities. We make sure asthma is considered in decisions about air quality, clean energy, urban planning, and climate action, because proactive policies and cleaner air saves lives.
Let's move on now to resources and final thoughts as we aim towards the conclusion of this podcast episode. What resources would you encourage listeners to explore through Asthma Canada?
So I'd encourage listeners to start with our website, asthma.ca. It's a trusted, evidence-based resource for people in Canada with asthma and their caregivers and families and educators, offering tools like asthma action plans, educational guides, clear information about symptoms, triggers, medications, all designed to help people manage asthma safely and confidently. For families with children, we have something really fun called Mission Breathe. It's a space-themed interactive game designed for kids ages 5 to 10 to learn about asthma in a way that's engaging and easy for them to understand. Games, quizzes, videos, and characters. Kids get to learn what asthma is, how to spot and manage their triggers, what to do in an emergency, and the importance of speaking up about how they feel. So parents can explore it alongside their children or let them play independently. It's really about kids and building confidence and learning to manage asthma in a stress-free, fun way. We also offer a free asthma and allergy helpline where you can speak with a certified respiratory educator for personalized support and advice. You can call the helpline toll-free at 1-866-787-4050 or email info@asthma.ca. Whether you have questions about medications, triggers, action plans, day-to-day management, our team is there to help. And then finally, I'd recommend signing up for our newsletter. It's an easy way to stay informed about news, resources, advocacy initiatives, research updates, and ways to get involved. So staying connected with Asthma Canada helps people feel supported, informed, and empowered in managing asthma within that community.
You think about the future, what gives you hope right now, genuinely?
So what gives me hope really is the strength and growth of the asthma community in Canada. More and more people are speaking up, like yourself, Josh, sharing their stories, advocating for better care, not just for themselves, but for everyone living with asthma. And we have a lot of people who are sharing stories of the loved ones that they have lost to asthma and rallying around that cry so that no one else has to experience that same thing that they have done. I see patients, caregivers, healthcare providers, advocates, organizations coming together, willing to get behind asthma, better control, better management, better resources and support to raise awareness and push for change. And that collective energy, people supporting each other, demanding better policies, spreading knowledge, that's really what gives me real optimism that the future of asthma care will be brighter, safer, and more equitable for everyone across Canada.
With that, we have reached our final question. And if you've listened to this podcast before, which I know you have, Jenna, I ask a philosophical question to end the podcast. Whether you have asthma or not, every breath we take is a gift, a reminder of our resilience, our drive to keep going, and our power to define our own limits. With a single breath, you have the potential to move mountains and change the world. So with that in mind, again, I have one final question for you. If you had only one last breath, but with it the power to influence the world, what would your message be?
If I only had one last breath, I'd say this, that breathing is something most people take for granted until they can't. Breathing well shouldn't be a privilege. Everyone deserves the information, care, and support they need to live fully, not just survive. And we can design systems that take people seriously before they reach a crisis. And that's a choice that we can make. So for that last breath, I'd say that asthma deserves to be taken seriously in our healthcare systems and in our investments. With nearly 5 million people in Canada living with asthma, there are too many that still face preventable crises and limitations. But when we invest in research, innovation, better care, we change lives in very real ways. And so that's the future that I'd want to influence, one where asthma doesn't define or limit anyone.
Thank you for listening to Beyond the Wheeze. I'm your host, Josh Rayholm. If today's conversation resonated with you, follow the show and share it with someone who might find it helpful. Guest bios and resources from this episode are available at beyondthewheeze.ca, and additional resources can be found in the show notes. Follow us on LinkedIn, where recap blogs are posted every Friday following new episodes, which are released every second Tuesday. You can also follow me on Instagram at The Asthma Runner. Remember, live with it, not in it. This is Beyond the Wheeze.